One tablespoon is 10 ml, 15 ml, 20 ml, 25 ml. The answer is 15 ml. A heparin vial of 5 ml consisting 1000 unit. The order is to administer 500 unit. What will be the amount in ml need to be administered? Options are 2 ml, 2.5 ml, 3 ml, 5 ml. The answer is 2.5 ml, half of the total amount. Next question. The prescribed dose of pediatric antibiotic is 350 mg. The available dose 500 mg diluted with 10 ml sterile water. The amount need to be administered is 5 ml, 7 ml, 9 ml and 10 ml. The answer is 7 ml. Prescribed dose divided by dose in hands into dilution. Which of the following is not included in the 10 rights of medication administration? The options are right client, right response, right documentation, right route. The answer is right response. Next question. The gauge size of needle used for subcutaneous injection is? Options are 16, 18, 22, 26. The answer is 26. Next question. The most preferred site of IM injection, intramuscular injection, before the age of 7 months. Options are ventrogluteal, vastus lateralis, deltoid, dorsogluteal. The answer is vastus lateralis. Next question. The most preferred site for IM injection for adults is ventrogluteal, vastus lateralis, dorsogluteal, all of the above. The answer is ventrogluteal. Next question. Which of the following route of administration is selected for a rapid action? Options are intradermal, intravenous, subcutaneous, intramuscular. The answer is intravenous. In a child, to administer an ear drop, the pinna is pulled upward and backward, downward and backward, sideward and upward, sideward and downward. The answer is downward and backward. If oil-based dye used for myelography, the position patient is lithotomy, Trendelenburg, Semi-Fowler's, supine position. The answer is supine position. Next question. Clubbing of nail is due to hypoxia, trauma, anemia, all of the above. The answer is clubbing of nail is due to hypoxia. Next question. Inflammation of the nail base is seen in koilonychia, clubbing, paronychia, none of this. Answer is paronychia. Inflammation of the nail base is paronychia. Next question. The test is used for measuring collateral circulation. Schilling test, Allen's test, both A and B, none of this. Answer is Allen's test. It's for checking the patency of radial artery. Increased convexity of nails greater than 180 degree. Clubbing, paronychia, Bu's line, none of this. The answer is clubbing. Vesicle greater than 0.5 cm is nodule, ulcer, bulle, pustule. The answer is bulle. Next question. Unequal size of pupil is seen in connection with head injury and stroke, organophosphate poisoning, cardiac arrest and death. The answer is head injury and stroke. T-binder is used to support the upper limbs, lower limbs, perineum, abdomen. The answer is T-binder is for supporting perineum. Frequent painful straining in unproductive attempt during defecation is termed as farting, flatulence, belching, tenesmus. The answer is tenesmus. Next question. An example of hypertonic IV solution is 0.45% NaCl, 0.9% NaCl, 5% dextrose and Ringer lactate. The answer is 0.45% NaCl. Next question. Insensible fluid loss for an adult over 24 hours is 300 ml, 60 ml, 900 ml, 2000 ml. The answer is 300 ml for 24 hours. Ringer lactate is a solution rich in phosphate, magnesium, copper and potassium. The answer is potassium. When extreme extracellular fluid volume is lost, the patient will evidently show sign of hypernatremia, hyponatremia, hypokalemia, hyperkalemia. The answer is hyponatremia. Contraction alkalosis is the other name given for respiratory acidosis, metabolic acidosis, metabolic alkalosis, respiratory alkalosis. It's for metabolic alkalosis. In lumbar puncture, CSF is aspirated by inserting the needle between L2, L1, L2, L3, L3, L4, none of the above. Between lumbar vertebrae L3 and L4. Next question. A person weak in football becomes star in long jump is denial, compensation, displacement, substitution. The answer is compensation. A husband forgets to pay the bill and blames wife for not giving it earlier is displacement, substitution, projection, denial. Projection. Injecting an anesthetic agent around nerve to anesthetize a small area is local anesthesia, topical application, nerve block, epidural anesthesia. The answer is nerve block. Next question, when the angle between the joint increased, it is flexion, extension, adduction, abduction. Answer is extension. Movement of bone towards midline of the body. Flexion, extension, adduction, abduction. Answer is adduction. The exercise which affect the muscle length, isometric, isotonic, aerobic and passive exercise. It's isotonic exercise which affect the muscle length. Next question, MTP Act is enforced in medical termination of pregnancy. 1896, 1923, 1972, 1976. The answer is 1972, MTP Act. Movement count should be noted from 20 weeks, 32 weeks, 28 weeks, 14 weeks. The answer is 28 weeks. Breathing movement occurs in the fetus at 18 week, 11 week, 12 week, 20 week. Answer is 11th week. Next question, CST is contraindicated in compromised fetus, previous history of cesarean section, antepartum hemorrhage, all of the above. The answer is all of the above. Good fetal outcome in contraction stress test means false positive test, a negative test, a positive test, neutral. It's a negative test. Which of the following is a diagnostic finding in case of vesicular mole? Vaginal bleeding, varying degree of lower abdominal pain, expulsion of grape-like vesicles per vagina, fever. And the answer is expulsion of grape-like vesicles per vagina. The test used to examine cells from blistering skin condition is patch test, sank smear, skin scraping, none of the above. Sank smear. The malignancy of endothelial cells that line the small blood vessel is Kaposi's sarcoma, melanoma, lipoma, squamous cell carcinoma. And the answer is Kaposi's sarcoma. It's seen in AIDS, acquired immune deficiency syndrome. Test which is used to find allergens for patient who has allergies, patch test, sank smear, skin scraping and none. The answer is patch test. Painful eruptions along the area of sensory nerves is manifested in impetigo, pemphigus, shingles, chickenpox. The answer is shingles. Next question. Components or characteristics feature of seborrheic dermatosis, acne, psoriasis, none. And the answer is acne. Next question. Athlete's foot is the other name of tinea capitis, tinea pedis, tinea cruris, and none. The answer is tinea pedis. Which of the following is a disease characterized by the presence of hives? Keloid, seborrhea, eczema, urticaria. The answer is urticaria. Which hormone results in diminished muscle tone and mortality of GIT during pregnancy? Estrogen, progesterone, insulin, glucagon. The answer is progesterone. Half-life of HCG, human chorionic gonadotropin, 12 hours, 24 hours, 6 hours, 10 hours. Half-life is 24 hours. When did HCG disappear from the circulation? After 12 weeks of pregnancy, after 24 weeks of pregnancy, after 38 weeks of pregnancy, within 2 weeks following the delivery. The answer is within 2 weeks following the delivery. Which of the following hormone has immune suppressive activity? HCG, HPL, human placental lactogen, estrogen, progesterone. Answer is HCG, human chorionic gonadotropin. The backward flow of urine from the urethra into bladder is known as urethrovesical reflux, uretrovesical reflux, neurogenic bladder, bladder neck obstruction. The answer is uretrovesical reflux. A low purine diet advised for patients with calcium stones, uric acid stones, cystine stones, oxalate stones. And the answer is uric acid stones. Low purine diet is for uric acid stones.